Yeah.
Go ahead.
Okay, my name is Sandy Puente. I'm a caregiver of Frederick Alvarado. I take him to and from the doctors. He's a diabetic. Whenever he needs shopping, bathing, or any kind of assistance with his cooking, I'm there for him.
Okay.
24 hours a day.
What do you think works well about your health care? Is it going to the doctor, being seen by the same doctor all the time, or what?
I mean, that's pretty hard to answer because I don't feel that what you call it, that I have to go, but they tell me I have to go, so I have to go get blood checkups and things like that.
Do you feel that your needs are being taken care of every time you go?
Yes.
What doesn't work? What services do you need that you aren't getting?
I don't know really.
Can you answer one?
Yeah, denture work.
Is that something that is
Dental work,
really severely needed?
No, but he can't eat too well without his teeth, and the bottom layer.
See, I don't have any.
So
On
what?
the bottom located.
Okay, so what are they saying the reason why he can't have the?
Well,
bottom?
he wasn't covered. For some reason they cut it out, or they just told me that he wasn't covered. They don't even know if it's possible he can make dentures for him because they said the bone has gotten to the bone too much.
And there's no way
So-
that he can even be.
I had the dentures. The
But
only
I
they
am
come
still
out.
working.
Okay.
They come out and there were talk. They come out sometimes, and I feel embarrassed about it. A bunch of people in the store or something, they come out,
Mm-hmm.
so I just leave them off.
So as of today, you're still in a limbo of the dentures, right?
I hope so, yeah.
Okay. Have you spoken to someone down at the healthcare?
No, we have an appointment coming up
Okay.
with his regular doctor in a couple of weeks. So what we'll do is they're right down the street there. We're going to go down inside and I'm going to inquire more information on it.
Okay.
Sandy, can I ask you? Are you employed? Are you paid, or do you just
For what?
take care of?
You know, I'm a paid caregiver.
Okay. You live right across the street.
I'm right across the street.
Okay.
Do you know that there will soon be a change in services and that you will be enrolled in a managed care program?
What's a match care program?
Managed care.
What's that?
Well, there's something coming from the state. It's called dual eligibility. And you will be enrolled in it. And if you don't know what it's about, some of your services that you are now taking for granted and think that you have, down the line you may not have them.
Oh,
But anyone down at the healthcare facility, inform him that there are changes on the way?
Not at this point, no.
Okay.
You want to say something?
Okay. So the duals project means anyone who is signed up for Medicare and Medi-Cal, they're going to be put into one program that's kind of streamlining the services. Mm-hmm. And and most of the core services that he's been getting are supposed to be the same, but things may change. And part of what we're doing here is to try to get the word out to people who would be affected by this, that there'll be some changes in the way that they can access their doctors and and their health care. So
Okay, well, I'll make sure I bring that up when I see his doctor. When he goes to see the doctor, I'm going to ask him more questions.
Well, it's
Okay.
still in transition. They're going to try
I see.
down in Southern California first. At first it was going to be up here, but they changed their minds and they put it down in the Los Angeles area. But it's coming this way. It is coming this way. And people need to be informed about what changes are going to be made. What are your concerns about this change?
I mean, if your services were to change, what would you be concerned about the most?
In other words, if you found out that the doctor that you've been seeing all these many years, all of a sudden you can't see your doctor,
well, that would be hurting.
why?
Because who am I going to see?
Okay. You may not know this, but I think in 20-something or the other, there are not enough physicians now, even with this program coming online, to care for the people that are going to be under this program. There is a shortage of physicians in the United States, and it's definitely a shortage of physicians in California. So some people are not, even though they may have the dual eligibility thing, they're not going to be able to find a doctor who's going to be able to provide them with the care. So how do you feel about that if this changes comes to your health care plan and the doctor that you've been seeing all these many years, all of a sudden you can't access his services? You have to go to another doctor.
I wouldn't know what to do.
Okay.
It's hard to answer because
When he has to see other doctors, he's normally, he freezes up. He won't, you know, he don't feel comfortable.
Okay. So he's used to his doctor. He's
Yeah,
used to
very-
going with it to his own.
I didn't mean to speak out of
Oh,
line.
no,
but
no,
I
no,
just
no,
wanted-
no. This is good because people need to know that a lot of this information is not getting to the stakeholders. You're a stakeholder. You're a stakeholder. You take care of him. I've done in-home care. I know what it is when a person gets set in a routine and they're comfortable with their doctor. Then come down and find out down the line that the doctor they've been seeing that knows all about them is no longer there.
Yeah.
If you could speak to a public official about this, what would you say? And I want to hear from both of you.
Oh my God.
the first thing I'd ask is why they change.
That's a good question. The bottom line is that they're trying to streamline the system and to save money. But the bottom line is to save money. And in order to save money, something is going to get cut.
Yes.
We all know that. And most of the cutting is not done to the proposed budget, is to those that cannot afford to have to cut. Seniors, people that are disabled, the handicapped,
Yeah.
you know, and the elderly. So they're knocking at our door. We're going to cut this, we're going to cut that.
So the idea of the program is yes to save money for the state, but there are a set amount of services that they have to maintain that you're receiving.
By federal law.
A good thing is we're told that there will be dental services, and there may be vision services as well. So that may be actually in addition. But we're not sure exactly what the program will look like just yet. So again, that's why we're going on talking to people about it and asking questions about how things are working and how things aren't working for you.
If you could speak to a public official about
Oh
this matter,
my gosh.
what would you say? What would you say?
You want to know my honest opinion?
Yes, I
say,
certainly do.
don't worry about your pocketbook, think of your heart. And you know, that's the way I feel. That's actually the way I feel. And I'm going to get all sensitive on this, so.
No,
We gotta stop.
we need the
No, but I
compassion.
have to stop because I'll start crying.
Okay, all right.
That's great.
Yeah. What's that?
Do you have anything else you want to say?
No, I'm good.
Any questions?
Nando, anything you want to say? Your moment of fame.
It's all right. Okay.
Thank you so
Thank you so much
very,
for talking
very
with
much.
us.
So very much. I don't know whether you watch C-SPAN or public access TV or